Now, what are the basic tests that we do for an infertile couple? Typically, for a lady, we need to know whether she's ovulating. What is ovulation? Basically, we need to know whether she's producing eggs and whether the eggs are getting released properly. Sometimes, a woman who's having regular cycles may be not ovulating, even though majority of them are doing so. So the best way to check would be to do an LH test, which is the typical ovulation kits that are available over the counter. Or better still is to do a follicular monitoring test, which is an ultrasound-based test, wherein we're able to see if the egg is getting released. So ultrasound monitors the follicular growth, which will tell us if the egg is growing to its optimal potential, whether it is releasing on time, and also whether the endometrium is in sync with the ovulation. The second thing we need to check is the status of the fallopian tube. So fallopian tube is a structure which connects the egg and also the sperm. Basically, that is a place where the egg and the sperm meet, so we need to know the tube is patent. Now, this can be done either through a HSU procedure, which is a hysterocytogram. Here, a dye is introduced inside the uterus, and the dye has to go into the uterus and come out of the tube to tell that it is patent. It can also be done through an SST procedure, which is a sonocytogram, which is an ultrasound-based procedure, or through a laparoscopic procedure wherein a dye and see whether the dye is coming out of the tube. Usually we're able to visualize it. For a male, we check the sperm count. So these are the basic tests that we need to do to make sure that the couple is fertile.